Hello, I am Dr. Judy Mills, and I'm a pediatric emergency medicine specialist in the ER, and I'm also a pediatric sedation physician. But I love this place, First Women's Clinic, and I'm here to just share some news with newborn care for you. So I'm excited to be here today. First of all, I just wanted you to know that God knew your baby even before you were pregnant. And your baby is fearfully and wonderfully created by God. And I want to thank you for choosing life for your baby and taking these classes to learn how to become an informed parent. When babies are born, they do not come with any special instructions for their care. God wants you to grow closer to Him through Bible study and prayer. Spending time in His Word will equip you with wisdom and guidance to be the best parent that you can be. Now, before I get into my talk, I want to go over some online resources that are very important. So if you don't hear anything else today, these resources, the websites, and the phone numbers are the most important thing to write down so you will remember throughout your children's growing until they go off to college. Okay, so two important websites is Children's Healthcare of Atlanta website that stands for CHOA. It's www.choa.org. And the second one is with the American Academy of Pediatrics, www.aap.org. These are websites that you will find policies. I will refer to those throughout my talk about how they'll show good videos and teaching points for the parents. Now, there are some phone resources that are very critical. Of course, it's always important to have your phone number available of your pediatrician, but this is a phone phone number for the Children's Healthcare of Atlanta Nurse Advice Line that is available 24 hours a day, 7 days a week, 365 or 6 days a year. 404-785-KIDS, and KIDS is 5437. So 404-785-5437. The next two numbers are very important. There are Poison Control Center numbers. For the Georgia Poison Control Center, it's 404-230-8989. 404-230-8989. And the national number, in case you can't get to the Georgia number right away, is 1-800-222-1222. 1-800-222-1222. That is through. We're through with all those numbers. Okay, now we're going to start about, the first thing I want to talk to you about is there are 3 things that need to be done before your baby arrives. The first thing is choosing a pediatrician. You usually choose a pediatrician in your last trimester. And most offices will offer prenatal visits where you can meet the physician and learn about their practice. If this is your first child, then family and friends can recommend a pediatrician to you. Or you can search those websites that I gave you. Pediatricians are specifically trained to treat children. Children can be very different than adults when it comes to medical care, and they present differently than adults in certain situations. Now, the baby's first healthcare provider visit is usually 2 to 3 days after your baby is discharged from the hospital. Secondly, you want to choose, the second thing is you want to choose a car seat and have it safely installed before you go to the hospital. That must be done. Note that car seats have expiration dates on them. If expired, the material of the safety seat can crack or buckle when in a crash. Your baby needs a safe car seat to go home from the hospital. Every state requires that infants and children ride buckled up. The best car safety is one that fits your newborn and can be set up correctly in your car. Even the most expensive car seat may not protect your baby if it is not installed properly. Using a car safety seat correctly can help prevent injuries to your infant. The car seat should be rear facing until your baby turns 2 years of age. Always follow the height and weight requirements for your specific car seat. Never place an infant in a rear facing seat in front of an active airbag. In most cars, the safest place is in the middle of the back seat. In your manual on page 96 lists how to properly secure a child in a rear-facing seat. If you are having problems with installation of the car seat, most fire departments are trained in this area and are willing to help the parent. Okay, the third thing is choosing the method of feeding for your baby. You have two options: breastfeeding, which is very highly recommended, or bottle feeding. Breastfeeding will be another topic that will be presented to you at another time. After the birth of your baby, the cord will be cut. The baby will be checked by the newborn nurse. If the baby is doing well and does not have any medical concerns, then the vital signs, weights, measurements, and footprinting will be done in the delivery room or in the room where you have the baby. The baby will undergo a quick initial bath, and the baby is very alert during this time. This is the time that you will be given the baby to place directly on your skin, and this we call skin-to-skin contact. This is the most important time you have, and this gives you and your baby time to get to know each other. It's the most precious time you have. After that, you're going to be exhausted, but this is the time that you will just treasure many days. The benefits of skin-to-skin contact are: it soothes and calms both you and your baby. It helps your baby regulate their temperature, their heart rate, their breathing, and their blood sugar. It enhances bonding. It supports breastfeeding. So if for some reason you choose bottle feeding, this is still a wonderful time to breastfeed your baby during this first bonding. It helps the mother's uterus to contract, and I feel like dads should be allowed to bond this way too, with skin-to-skin contact. They will treasure that also. Okay, you will hear something about an APGAR score maybe there in the delivery room. The APGAR score is a quick and simple test your healthcare providers use to evaluate your baby's well-being at 1 minute and 5 minutes after birth. There is a chart on in your booklet on page 87 that kind of goes into details about how they get their numbers. 5 areas are evaluated: the heart rate, the color, the breathing, the muscle tone, and reflexes. This score helps identify infants requiring resuscitation for hypoxic events. Hypoxic events are those events that impaired oxygen delivery to the tissues of the baby. What is amazing is how your baby's appearance changes in the hours and days after birth. Really, if you take a picture on the first day, it does not look like your baby on the second day. And are they sure they got the ID band on the right baby? Okay. When you see your baby, as soon as he or she comes out of the birth canal, you will notice that your baby will be covered in a thick white cheesy coating that is called vernix caseosa. This vernix protects your baby's skin while floating in the amniotic fluid. Your baby's skin color will look bluish gray at birth. This is normal. As your baby breathes and oxygen starts to circulate throughout the system, you will notice that their skin, their lips, their mucous membranes, and their nail beds become pinker. Your baby's hands and feet may appear to be bluish or purple in color after birth. This is called aphrocyanosis and is also normal. Your baby's skin tone may continue to change in the weeks ahead. Some infants may be covered with fine hair. This is called lanugo. It grows on babies as they develop in the womb and provides additional skin protection. Lanugo disappears within a few weeks after birth. Babies can see about 8 to 10 inches away right after a term baby can. That is why they prefer looking mostly at your face. A baby's eyes are usually gray, blue, or brown in color. You will not know what the true color will be until about 9 to 12 months of age. You may also see your baby's eyes cross sometimes. This is normal and will usually correct itself within 3 to 4 months. If your baby has red spots in the whites of their eyes, do not worry. These spots are simply broken blood vessels from the birth process and will disappear within about 1 to 2 weeks. The plates of your baby's skull bones are not fused together at birth. They are designed to allow a baby's head to change shape as they move through that narrow birth canal. They also could accommodate your baby's rapidly growing head during the first year of life. The brain grows fastest that first year of life, and it's critical that you get enough good fat in your body during that first year. They also, you may also notice at birth that your baby's head looks out of shape. So this is referred to as molding. So a vaginal delivery baby is going to have a cone head if they've been in the near a birth canal for a while. A C-section baby is going to have a perfectly round head because they did not go through the stress of that narrow canal. You will find two areas known as soft spots on your baby's head. There is one at the top and one at the back where the skull bones have not yet grown together. These spots are called fontanelles. You have an anterior fontanelle and a posterior fontanelle. People think that when you are bathing your child, you should not touch those areas. It is fine when you touch them gently. You do not want any siblings banging on the top of the baby's head. The nose of your baby may appear as flat and may also be covered with what we call milia, M-I-L-I-A. These are small white bumps that are immature oil glands. Milia may be noted on the cheeks and the forehead, and they do not squeeze or pick at them. They will go away without treatment. The American Academy of Pediatrics recommends that all babies receive topical eye antibiotic ointment known as erythromycin to protect them from any eye infection. This is applied in the infant's eyes immediately after birth. Vitamin K helps with blood clotting. Babies are born with only a small amount of vitamin K, so they are at risk for vitamin K deficiency bleeding. An injection of vitamin K is given to the baby's thigh muscle immediately after birth. Metabolic screening is an essential preventive health measure. It tests for developmental, genetic, and metabolic disorders of the newborn. There are at least 35 genetic and metabolic disorders for which screening is recommended. The list of newborn screening tests vary by state. Most perform at least 30. Of every 1,000 babies born, it is estimated that 1 to 3 will have serious hearing loss. It is recommended that all newborns be screened for hearing loss before they leave the hospital. If hearing loss is not caught early, there will be a lack of stimulation of the brain's hearing center. This can delay speech and other development in your newborn. The test is painless and is performed using a tiny earphone, microphone, or both. It is done while the baby is still in the hospital. The test takes about 10 minutes and is done while your baby is sleeping. Hepatitis B vaccine will also be given to your baby before discharge. Now we're just going to briefly talk about jaundice. Jaundice is a common word, but I'll tell you why it is important to know about. It is common in the newborn babies. It gives yellow color to the baby's skin and eyes. Newborn babies have produced extra red blood cells for the birth process, and one of the breakdown products of the red cells is bilirubin. The liver in the newborn is fully developed but not 100% efficient. Therefore, extra bilirubin in the blood is stored in the skin until the liver is able to break it down. This buildup of bilirubin in the blood and skin is called physiologic jaundice. Most cases of jaundice will go away without medical treatment. Your baby's healthcare provider will monitor the bilirubin level and treat it if it is too high. You may need to make extra visits to the doctor's office or lab in order to be certain that the bilirubin level is within an acceptable range. If left untreated, high levels of bilirubin can cause serious complications involving the brain and the central nervous system. One of the treatments for hyperbilirubinemia, which means high levels of bilirubin, one of the treatments is called phototherapy. This treatment is just with a special light. The baby will be placed under the light wearing only a diaper and special eye protection. The lights will not hurt the baby. Another option for treatment is called a fiber optic blanket, and that is placed under the baby. The light and blanket are sometimes used together. These lights can be used at home. The blood levels will be monitored on the baby closely. Babies will get rid of bilirubin through their stools. You will want to feed your baby 8 or more times a day for the first few days to help keep the bilirubin level down. Your baby's skin may be dry and peeling, particularly on the feet, hands, and scalp. This is simply the shedding of dead skin and is best left alone since lotions tend to slow the elimination of these layers. So do not apply lotion on your baby's skin unless they develop eczema later in age and they will need a special kind of lotion or cream. Do not use any baby powder because it is easily inhaled and can cause breathing problems in the infant. It is best just to pat the diaper area dry after changing the baby. Babies' fingernails and toenails grow very fast. The fingernails will scratch the baby's face when crying or asleep. Some babies look like they've been in a battle by the time it's morning. You can purchase mittens for the baby's hands to help minimize scratches. Avoid cutting the nails with clippers or baby scissors when the baby is young. Use a baby emery board while the baby is asleep or calm in your lap. Gently file the nails, not vigorously. You may need to file the nails usually about 2 to 3 times a week because those first few months they grow very fast. Diaper rashes are common. Treatment is to create a barrier between the baby's skin and the moisture. Vaseline, vitamin A and D ointment, Desitin, and butt cream provide a good skin barrier to use if redness or irritation is noted in the diaper area. Cradle cap, which is called seborrhea dermatitis, causes rough, thick, scaly patches or crust on the baby's scalp. It can also be noted behind the ears and over the eyebrows. This is common. It is not contagious. It will usually go away on its own. It does help to gently massage the scalp with a soft washcloth while shampooing. You do not want to scrub the poor little baby's head. If the cradle cap is severe, you may need to use a special shampoo that contains selenium sulfide. You do not want to put oil on the scalp to loosen the crust. It will make the condition worse. And when you use the special shampoo, if you're using it, do not let it get into the baby's eyes because it will burn the eyes. Thrush refers to a type of yeast infection that develops in moist areas on the body, especially under the chin of a drooling infant or in the form of a diaper rash. Oral thrush is a common type of infection that occurs in the mouth of babies. With this infection, you may see white patches inside your baby's mouth, such as on the tongue or inside the cheeks or on the roof of the mouth. The best way to know if this is thrush or just milk is to try to wipe it off. If you're able to wipe it off with a wet, soft washcloth, then that means it's milk. If it doesn't come off, then that means it's probably the yeast infection. Although the infection is very irritating and can impact a baby's daily eating and sleeping habits, it can be treated with medication to be used in the mouth. You will need to notify your healthcare provider. The diaper rash caused by this same yeast can also be treated with an antifungal diaper cream known as 1% Lotrimin cream, and that is over the counter. Now we're going to talk about safe sleep, which is very different than we did when middle adult children were babies. So things have very much changed in the last 40 years with safe sleep. And then the AAP has made a really new recommendation in the last couple of years. So we're going to kind of cover that right now. The Center for Disease Control and Prevention estimates that nearly 3,500 infants die suddenly and unexpectedly each year in the United States alone. These deaths are called sudden unexpected infant deaths, and it is labeled as SUID. About a half of all sudden unexpected infant deaths are due to the sudden infant death syndrome, or SIDS, which we hear a lot of. And SIDS is a sudden infant death that cannot be explained. SIDS is the leading cause of the sudden unexpected infant deaths for infants under 1 year of age, especially from birth to 4 months. So one of the American Academy of Pediatric strategies for preventing SIDS is called rooming in. The AAP states that the safest place for your baby to sleep is in a separate, safe sleep space, but close to the parent's bed. Babies should sleep in their parent's room they are recommending for at least 6 months, ideally for 1 year. And I can't make any comment on that because I was really into sending my children in their room, but we always use monitors. But this is what is recommended, and if this is bringing numbers down, then I think we should seriously consider it. One of the best ways to reduce the risk of SIDS is to put healthy infants on their back when putting them down to sleep at nighttime or nap time. And the AAP recommended that all babies be placed on their backs in 1992. Since that time, deaths from SIDS have declined dramatically. You want to make sure you share this important information with babysitters, grandparents, and other caregivers, because my children slept on their stomach, but in 1992, babies have been sleeping on their backs, and it has definitely made a difference. It is also important for parents and all caregivers to take an infant CPR course. Sleep-related deaths from other causes have gone up. Other causes include suffocation, entrapment, and asphyxia. Asphyxia is just a deficient supply of oxygen to the body that arises from abnormal breathing. The safest place for a baby is to sleep on a separate sleep surface designed for babies that is close to the parent's bed. You want to use a firm mattress in a safety-approved crib covered by a tight fitted sheet, and that's all that should be in the bed other than the baby. So a firm mattress in a safety-approved crib with a tight fitted sheet and the baby, and that's it. Make sure nothing covers the baby's head. Dress your baby in sleep clothing such as a one-piece sleeper and do not use a blanket. Always place your baby on their back to sleep for naps and at night. You keep pillows, sheepskins, crib bumpers, small lovey blankies, and toys out of your baby's sleep area. You do not let a baby sleep on soft cushioned sofas or chairs, or soft body pillows or water beds. Do not share a bed with your baby, and do not smoke or let anyone smoke around your baby. That increases the chance of SIDS. Okay, now we're going to talk about shaken baby syndrome, and you'll see that is called SBS. If you are a parent of a new baby, there may be times when you will become frustrated and maybe even angry when your baby cries. You may have tried everything to comfort them, but nothing seems to help. You are not getting any sleep, and you may feel very distressed. No matter how you feel, do not shake your baby. The shaken baby syndrome, also called abusive head trauma, is what happens when a baby is violently shaken. The movement of the baby's head back and forth can cause bleeding and increased pressure on the brain. A baby's neck muscles are not strong enough, and the brain is too fragile to handle this whiplash emotion. Shaken baby syndrome is one of the leading forms of child abuse. Many babies die. Many others have irreversible brain damage. Those who survive may have visual disturbances of blindness, mental injury, paralysis, seizure disorders, learning and speech disabilities, or neck and back damage. Babies cry for many reasons. They could be hungry or have excess gas on their tummy. They may need a clean diaper. Their clothing may not be appropriate at the time, such as they may be too hot or too cold, itchy, or their clothes too tight. They may want to be held and rocked and walked. They may need to go to sleep because they're overexhausted. If crying is persistent, then you may want to check for a hair tourniquet on fingers, toes, or the penis. Hair tourniquets are usually caused from when you wash the onesies, the baby's clothes, in the dryer, there's hair and lint, and it gets into the very end of the little toes or the little mitten areas. That first 3 months, they're wearing little outfits that cover their fingers. And of course, mamas can have long hair that can come off anywhere. And so this is common that we see in the emergency room, is hair tourniquets and the parents find that out because the baby has cried a lot and then they happen to go see that. But that is off track a little bit. If you are feeling like you cannot deal with your baby's crying and you have met all of your baby's needs, then stop. Think and reach out for help if you need a break. There may be times when nothing you will do will stop the crying. This is normal. Do not shake your baby. If you think your baby has been shaken, take them to the children's emergency room immediately. Do not let fear, shame, or embarrassment keep you from doing the right thing. Getting the necessary and proper treatment right away may save your child's life. I'm going to just kind of give you some signs and symptoms of what it looks like for a baby that's been shaken and has had the shaken baby syndrome. They may have irregular, difficult, or shallow breathing, or their breathing may just stop. They're extremely fussy. They may start having seizures or persistent vomiting. They're hard to feed, hard to stay awake, no smiling or vocalization like they have been doing, not able to focus or track movement with their eyes. Now, what to do if you get frustrated? Never throw or shake your baby no matter what. Stop. Take a deep breath. Close your eyes and count to 10. Put your baby down in the crib and leave for a few minutes to calm down. Give yourself a timeout. Ask a trusted friend, neighbor, or family members to take over for a while. Do not pick the baby up until you feel calm. If you think the baby is sick, call your healthcare provider right away or take your baby to the emergency room. Unfortunately, I see many cases of shaken baby syndrome. It's very sad. Okay, the next topic I'm not going to talk about that I used to is called Swaddle Smart. It is on the CHOA's website. It's how to swaddle an infant properly so they will sleep better for you, that they will cry less. You want those little arms swaddled down, but you want their hips and their legs moving well. And so that's on the CHOA's website called Swaddle Smart. Now I'm going to talk a little bit about tummy time, because when you're putting your children down in the crib for night time and nap time on their back, they're going to have flat heads. So that's why it's very important to have tummy time. Tummy time includes any time that your baby is not laying flat on their back. This helps develop the muscles in the baby's neck and shoulders. It helps prevent tight muscles and the development of flat areas on the baby's head. And this helps build the muscles your baby needs to roll, sit, and crawl. The CHOA website also has some great pictures on tummy time and information on tummy time. Okay, so we're getting close to the end. And I'm going to talk to you about serious things. When your baby's lips turn blue, or if your baby's color goes from normal color to gray, pale, and light blue, or has difficulty breathing, you call 911. Okay. Otherwise, you can call your doctor and ask questions, or always know that that nurse advice line is available 24 hours a day. So these are symptoms and signs of when your baby is getting sick. They are very fussy and cannot be consoled. They eat poorly or they refuse to eat. They had no stools for 2 days and less than 6 wet diapers a day. This is for your first 6 weeks. They are stooling all the time those first 6 weeks. This is not when you're 6 years old and may stool once every week, okay? You have a redness about your umbilical cord area, or you're seeing blood, a drainage, or have a foul odor around your umbilical cord. The baby does not urinate within 6 to 8 hours after circumcision. If you know that the baby has a temperature of 100.4 rectally or more, and the CHOA website will teach you how to easily take a rectal temperature with a digital thermometer. If the baby has difficulty breathing, if the baby has repeated vomiting or several refused feedings in a row, if any of the vomitus looks green in color and it's been 1 or 2 times, that's an emergency. That child needs to be seen in the emergency room. If there's listlessness, or if the baby is hard to wake up. If the baby cries excessively with no known cause, or an unusual high-pitched cry. If you see an unusual or severe rash, not your typical prickly heat rash. Or if the baby has frequent, successive bowel movements with lots of fluid or water, mucus, blood, and or very unusually foul odor. Bring a sample in when you bring your baby in. And of course, if the baby looks dehydrated, and what does that mean? Dry lips, cracked lips, dry skin, rough tongue. Increased sleepiness or irritability is a sign of dehydration, and of course, marked decreased urine output. Okay, and then my last thing I'm going to leave you is with some child-proofing safety tips. This is coming from an emergency room doctor, okay? Never leave an infant in a carrier alone on a bed, a table, or a surface where the baby could fall. When the baby is sleeping, it is okay to leave them in their carrier, but leave the carrier on the floor in the carpeted area, and make sure there's no pets or toddlers that can go over there and hurt them. A baby's sleeping area should be free of strings on sleepwear, bedding, or pacifier. Cords connected to the blinds or window treatments and cords from the baby monitor should be out of reach. You want to install gates at stairwells when the baby begins to roll on the floor. Plastic garbage bags and garment bags should be kept out of reach. Keep any object that can pose a threat to a baby out of sight or reach, such as nuts, and we especially see so much aspiration with small pieces of peanuts, like in the Snicker bars after Halloween. There's something about nuts, but particularly peanuts, that children get choked on and then it gets into their lung. Small pieces of carrots, whole grapes. A child died at a grocery store when his mother gave him a grape. It got lodged in his airway, and even the paramedics could not get through that grape to get a endotracheal tube in his airways. So whole grapes, I'll never forget that story. Popcorn, hard candies, coins, buttons, beads, button batteries will tear your GI tract up, or anything that could become loose and be swallowed. Keep all medication out of reach and sight of children. Be sure all unused wall sockets are capped with safety plugs. Sockets are objects of great curiosity for a crawling baby, mainly because they are at their eye level. Safety locks should be installed on the doors exiting a house or doors to a pool area. Safety locks should be installed on all cabinet doors that have dangerous chemicals or cleaners inside. Do not hold the baby while cooking. Hot food or liquids could splash on the baby, or a hot pan could touch the skin and cause a serious burn to the baby. Always turn the pot handles inward. Never leave an infant or child unattended in a car, a bathtub, or a body of water, not even for a moment. And thank you so much. I hope you learned a little bit about my tips and my love for children, and I hope this has helped you with your newborn care. Have a blessed day.